Good morning, ladies and gentlemen. Respected His Excellency Vajubhai Wala, Governor of Karnataka. Respected Mr. Ian Felton, British Deputy High Commissioner to India. Respected Mr. B.N. Vijay Kumar, Member of the Legislative Assembly, Government of Karnataka. All the invited guests, friends, Team Cadabams, ladies and gentlemen. While I was asked to date back to what has it been in 22 years of Cadabams to what we are today, there's one statement which comes to my mind, a humble beginning where we started off to being a care home for persons with psychiatric illnesses, mental retardation, as it was known then, to intellectual disability now, to that of a comprehensive mental health care service provider. Respected Your Excellency, I stand before you to present a few facts. Today, the spectrum of services which Cadabams offers for can be rendered in 5 statements of mine. To that of a child in a school to a teacher teaching them, to a HR professional to an employee, an aspiring entrepreneur to a businessman, a family with problem to a person with problem with family, a person with minor mental health problems to a person who does not even know what is it to be, a person with mental retardation to addiction related issues. This is the whole range of spectrum of services which comes under the bandwidth of Cadabams today, which makes us one of the most comprehensive mental health care service providers. How has it all been to having it holistic in our approach? Is merely so because of the professionals who comes from various walks of life and spheres who contribute at various levels. That has enabled us to focus on having specialty centers, treatment deliveries at care levels where we specialize in our treatments. The holistic structure has primarily been because the vision which Mr. Cadabam M. Ramesh always sets us to, which says enable quality mental health care to all. I wanted to share a brief conversation and discussion that I had with Shri B.N. Vijay Kumar when I went forward to invite Sir for our occasion. He said, "What is this all about, this addiction, drugs, alcohol, depression, schizophrenia," as Sir was interested to know. I said, "Sir, that's rampant. There's one thing that amongst all of us in the audience know is 1 person in 4 families does suffer from one or the other form of mental health problems." It really doesn't stop there. That tells us that 7% of this country to 10% of them are with either major mental health problems to that of minor mental health problems. I thought I'll bring in and highlight some key facts. While we are sitting here in this August gathering, there's one drunk driving fatality which occurs every 53 minutes around the world. And there's 1 person who dies of drug overdose every 19 minutes. There's 3% adults who are with known bipolar disorders. About 45 million people around the world does suffer from dementia at this point in time. And out of which 2.5 million people are even under the age of 65. Going forward at the same rate, in 2050, we would be touching 135 million people. And this is all around the world, and we contribute to a greater part of the world population today. There's much spoken about depression, schizophrenia. There's a larger aspect to mental health on psychiatry or patients looking out for psychiatric help beyond core issues of depression. While we all understand depression could be like the common flu as in the general health scenario. This brought us to a place to say we need to complete the value chain, and this latest edition of Cadabams Hospitals really looks forward to tap the value chain of mental health care services to be able to respond to acute psychiatric needs where there is a need for psychiatric intervention, professionals from the behavioral sciences to that of professionals in arid field. Supportive services which also go hand in hand. Yeah? While I take pride to present Cadabams hospitals, which is a specialty in neurology and psychiatry, which is due for operations mid of January, the acute services, which I missed earlier, are supported by therapies such as DTS, DTCS, RTMS, neurofeedback, biofeedback, and the comprehensive cognitive retraining, and many more. This whole concept of emergency psychiatric helpline, the emergency services, or primarily focusing on psychiatric helpline, is so much more important today, though it's not given its due importance, is because there are 30 to 35 lakh individuals in this country who need hospitalization at any given point in time owing to their behavioral condition. And that's a big number. Many of them would end up not seeking help. Statistically, only 15% of these individuals would end up getting one or the other form of help. The downside to it is these treatments are not covered by either of our insurances. They're not covered by any of the state or the national funded programs. Nonetheless, people still go out to seek help as an out-of-pocket expenses and the limited infrastructure which is available in the social setting. So while we present to you our psychiatric emergency helpline, it would act as a godsend to the families and the patients alike at the times when the critical times when they need our professional help and advice. The helpline offers for professional support and would be manned by a mental health professional. They could also use our ambulance services, which are times which will complement our crisis team as a support offered for. The people who primarily seek help from psychiatric emergency services would be the alcohol and drug withdrawals, people in alcohol and drug withdrawal symptoms, drug and alcohol abuse and consequent behavior, unable to take care of self, instances of violence, threat, possession of weapons, attempt to suicide, person feeling low or depressed, to person feeling aggressive or being aggressive, having suicidal thoughts and non-cooperation. Our mental health professionals would ideally triage the call and, according to the situation, help them handle the immediate problem. The problems would be ideally handled with safety, securities, and legalities. Our professionals would suggest, and the best course of action can be chosen by the caller. Our psychiatric services team would be equipped to deal with emotional, psychological, physical, and traumatic experiences. The crisis handling team is also trained to handle violence and aggression associated with psychiatric illnesses such as depression, schizophrenia, bipolar, and patients no cooperation. While I'm signing off my address, I look forward to unveiling of a psychiatric emergency helpline by Mr. Ian Felton. I would also look forward in the next couple of years to take our initial discussions forward in looking at establishing either one or all of our centers in the United Kingdom in coming years. Thank you for all the support rendered by your office, your government in the United Kingdom with the UKTIAM. Thank you. 22 years of a journey in mental health is probably just another opportunity for me to thank each one of them or all of them and many of them who've contributed in one or the other way to help us render services which has helped and reached thousands of people. Thank you very much for your kind attention. Please join hands with us to spread the word of Psychiatric Emergency Helpline. Hope we reach many more to come in years. Thank you.